my name is Brittany Todaro.
And I'm Nico Merritt.
And we're doctor and athletic training students at Indiana State University. And today we're going to demonstrate a mobilization with movement technique with the lumbar spine, increasing flexion and extension.
And we'll also be showing you a mobilization that you can do at home if you don't have someone to help you and a clinician to perform the technique on you. So what we're going to do to apply this mobilization to the spine is we're going to use a belt and strap, and you can use one that has a loop on it, or you can use one that just cinches so that you can have a tightening that you can apply for your patient to be most comfortable. Then what we're going to do is I'm going to wrap that around my back so that I can apply, and then we're going to wrap it around my patient, and she's going to put it at the level of her ASIS, and I'm going to put mine where I feel I can get the most movement, just below my PSI, so I can sit into the belt. I'm going to tighten the belt just a bit. And what we're going to do today, Brittany, is we're going to do a mobilization of your lumbar spine to increase movement. Right? So what I'm going to do is I'm going to apply a force backwards that's going to pull your body backwards. You feel that?
Yes.
All right. And then I'm also going to be pushing on that painful spot on your spine, and we're going to have you go through a backwards motion and a forwards motion.
Okay.
All right, so those would be flexion and extension to increase those ranges. So then I'll be pushing in a superior anterior direction towards her eyes and forward towards her chest at the spinous process that's most painful. And at the same time, she's going to be going through that painful motion, and we'll get an alleviating of symptoms. So go ahead and come back. Good. And go again. And we'll do this a series of 5 repetitions as needed, maybe increase the sets. And then to increase flexion, we're going to do the same force, and she's going to lean forward. So Brittany, you're going to go forward, lean into flexion. Pushing on that spinous process, I'm using the hook of my pisiform, the bottom pisiform grip, to push on that spinous process as she goes through this mobilization.
So this is a technique to increase lumbar flexion or lumbar extension that the patient can do at home. So this is a self-mobilization with movement, applying the same force to the spine and using the belts. So what you're going to do is attach a longer belt to a door handle. Make sure the door is locked so the door isn't open. And you're going to place it at the ASIS. And you can do this standing up, it may be a little easier. Then you're going to take a smaller belt, place it at the level of the spinous process that's causing pain, and you're going to use this belt to pull superiorly and anteriorly while you're doing simultaneous flexion or extension. So I'm going to lean into the belt at my ASIS, I'm going to pull upward and anteriorly, and then I'm going to lean back into extension while I'm pulling, and then go back to the center. Lean back, lean forward. I can do this for flexion as well, pulling in the same direction at the painful spot. Go forward, back, forward, back. And you can do this for 3 sets of 10 repetitions, and you can hold the flexion or extension for 3 to 5 seconds at each end.
Thank you for taking the time to watch this video. If you have any questions, you can email us. The email's in the description box below.